So what I want to do is let's just get to the nitty gritty and understand most of you are practicing PAs and students. So we understand and know what the PA is. What is a physician assistant? So it's a lot, you all who are practicing, your licensed medical professionals, those of you in school, you know you're going forward to become a licensed medical professional, and you're able to provide direct patient care in collaboration with the supervising physician. Point blank, period. That is the basic definition of the role, similar to that of the advanced practice nurse, particularly nurse practitioners. The role of the PA and the role of the NP are similar, but we know that the educational route, the academic routes are different, but nonetheless, typically where you see nurse practitioners practicing, you will also see physician assistants practicing. So yet the roles are different, the educational routes are different, but in some ways the roles are similar. And as I mentioned, for the most part, physician assistants are able to provide a wide variety of services to a wide variety of patients in a wide variety of specialties. So there really is no limitations what PAs and the role of the PA, including even first assist in surgery. So you guys already told me in the beginning your specialties where you work. I saw OBGYN, I saw psych, I saw ENT, I saw primary care, I saw ER, I saw urgent care, I saw it all. So you know that in your role, there's really no limitation in what you can do working with your physician and non-physician counterparts. So while PAs work in collaboration with a supervising physician, it doesn't mean that you have to work under direct supervision. Most of you probably know that already. If not, all of you who are practicing know that the physician doesn't have to be over your shoulder looking and making sure you're doing everything right. So most work independently, operating under a set scope of practice determined by state law. Very similar, if not the same, as nurse practitioners. So let's look at some stats here. So the majority of PAs, about 80% of PAs, either work in the hospital or office-based setting. Hospital setting has the greatest number of PAs, about 41.6%. So a large amount of PAs go into the hospital setting, and there's nothing wrong with that. That's just the role, that's just the route that a lot of PAs go into. About 23.7% of PAs work in primary care, so family, general practice, internal medicine, and pediatrics. However, and when I saw this stat and I thought this was crazy because I was like, well, what do you mean? So the percentage of PAs practicing primary care has decreased in the past 5 years. And that's crazy because we still have a shortage of primary care providers. So why is it that PAs are not practicing in primary care? Maybe it could be a lot of different reasons. It could be lack of opportunities. It could be, the salary. It could be, just maybe the roles are given more to nurse practitioners. Let's keep it real. But that doesn't mean because the PAs practicing in primary care has decreased in the past 5 years, that doesn't mean that can't change if PAs consider owning and starting their own practices. Now, when I say primary care, I'm not just talking about, regular general medicine. I'm also talking about any type of care that is provided in an outpatient setting. So the stats are saying that PAs are actually working more in the hospital than they are in outpatient settings. So, and because we have a shortage of primary care services, quality primary care, that really concerns me. So how much money do PAs earn? I don't need anybody to share their income in the chat, but you can, say you agree, or maybe you're an outlier, maybe you make a lot more. But what the stats say is that about 10% of physician assistants lowest paid is about $78,000, and the median salary was $121,000, and about the highest was $164,000. Okay, so Those are the numbers. That's what research is showing. According to the Bureau of Labor Statistics, family and general practice physicians earn about $225,000, while physicians on average earn about $121,000 doing the same work. So the truth is your physician counterparts are making double what you make. Now, we understand, we love our physician counterparts. I do. I know some great physicians, but how many can be honestly say, you know what, that's a little concerning that although my physician counterparts have more schooling, more education, but we are doing the same work, that they're making nearly double than what you make. Okay, so maybe somebody can agree and say, you know what, that is a little concerning. And that most of you can probably say, well, I don't even make, 121,000. Maybe you make less than that. Maybe you make a lot more less than that. But these are the statistics. So this is what the studies and the data is showing. So let's talk about how much revenue you're generating for your employer. So a PA brings in about $231,000 a year into a practice, taking home an average salary about $84,000. Okay, your salary is less likely to increase because what ends up happening is that another PA will be hired to double the revenue of that company. I mean, that just makes sense. So we're talking business here. These are the things they're not going to tell you or teach you in school. So, not that I'm saying it's impossible for you to get a raise or go somewhere and make money. But the truth of the matter is the way the system is set up is for you to provide that additional support, bring in that additional revenue, see more patients, but yet your salary is lower. And in some cases, depending on where you work, your salary will be capped. No matter how much more, you could be bringing in $1 million in revenue for that company. But if you are capped or you're paid at $100,000, you're not going to see anything more just because you're doing more work. So to compare it to the nurse practitioner role, NPs bring in approximately $400,000 a year and make an average salary of about $124,000. And this is very correct. There's actually, companies that bring on nurse practitioners specifically, and they are bringing in multi-seven figures with hiring those additional nurse practitioners. So although NPs are paid more on average, they statistically can bring in more revenue. And so that's something to consider in regards to your role and how you see your future being employed as a physician assistant. So let's take a moment of truth here. The PA is a noble career and vital to healthcare. However, the additional revenue you can bring in is not very significant, and the earned income is less than that of your professional counterparts. Okay, so I like to, give it straight, no chaser, just telling you guys, as much as we need PAs, as much as your role is vital, the truth of the matter is when it comes to you and your money, your income, you're making less statistically, and actually you're bringing in less statistically to your place of employment.